Gastrointestinal complications of granulomatosis with polyangiitis. Definition. Granulomatosis with polyangiitis is a small and medium vessel vasculitis with a predilection for respiratory tract and kidneys. It causes urinary necrosis of a small and medium-sized vessels, leading to the organ dysfunction. Gastrointestinal involvement is seen in only 5 and 10% of the case in a poor prognostic factor.
This is Simon Downs for Medical Radio, bringing you the best in medicine and music. Okay, we are back, and we're going to continue with our path bites. Listening to a little bit of music in the background. So, let's talk about granulomatosis with polyangiitis. Granulomatosis with polyangiitis is the new and proper name for a disease previously called Wegener granulomatosis. Wegener granulomatosis was the accepted name for this disease for many years, even though the physician who named the disorder, Dr. Friedrich Wegener, was known to have been a member of the Nazi Party. In the 1930s, it was apparently not uncommon for physicians to join the Nazi Party simply to keep their positions at universities and hospitals. So perhaps keeping Wegener's name in the disease isn't so surprising. In fact, Wegener was awarded the title of Master Clinician by the American College of Chest Physicians in 1989, and the title has since been rescinded. Things changed in 2011 when a doctor at the Mayo Clinic in my home state of Minnesota delved a little deeper into Wegener's life and found evidence that Wegener's membership in the Nazi Party was not just a name-only kind of thing. He also was a member of the Sturmabteilung, also known as the Brown Shirts, which terrorized Hitler's opponents. There's other very unpleasant stuff too that we don't need to go into. So all the major medical organizations have renounced the name Wegener granulomatosis, and now granulomatosis with polyangiitis is the official name. It's even in Robbins, so that seals it up. Granulomatosis with polyangiitis is a necrotizing vasculitis characterized by a triad of findings. First, acute necrotizing granulomas of the respiratory tract. Next, vasculitis of small to medium-sized vessels, especially in lungs, and glomerulonephritis. It's probably caused by some kind of T-cell mediated hypersensitivity reaction to some inhaled infections or environmental agent, but nobody is sure what that agent is. Finally, PR3 ANCAs, also known as C ANCAs, are present in almost all patients. ANCA stands for anti-neutrophil cytoplasmic antibody. We'll talk more about ANCAs on Wednesday, but for now, just know that it's not uncommon for patients with vasculitis to have antibodies against antigens in the cytoplasm of neutrophils. I know, it's super weird. In granulomatosis with polyangiitis, you can follow these antibodies to see how well patients are responding to treatment. If you're hungry for more, please go to Robbins' 9th edition, page 511.
Applications in medicine. The disease proved fatal despite aggressive management. Poor prognosis with intestinal perforation is well known. Intestinal perforation in GPA is a rare manifestation of the disease. Until date, at least 11 cases have been reported in the literature. The mean age of patients having an ANCA-related perforation was 48 years. The most common sites of perforation were jejunum, ileum, stomach, and esophagus. The small bowel was involved in all cases with ileal involvement. In 9 the 82% of the cases, ulceration, perforation, and the most common pathologies.
Disorder called ANCA-positive vasculitis, and a new study that the Mayo Clinic is participating in at this time. Most of you already know something about the immune system. When the immune system functions normally, it helps to fight off viruses, bacteria, and cancer cells. When the immune system functions abnormally, you may develop unusual infections or damage to the normal cells and tissues of your body. Autoimmune disorders develop in such circumstances, and you already likely know about some of them, including rheumatoid arthritis, systemic lupus erythematosus, dermatomyositis, scleroderma, and vasculitis. One of the most common types of vasculitis is ANCA-positive vasculitis. ANCA stands for anti-neutrophil cytoplasmic antibody and represents the antibody that can be found in your blood when you have one of these conditions. There are actually three of these, including granulomatosis with polyangiitis, previously called Wegener's granulomatosis, microscopic polyangiitis, and eosinophilic granulomatosis and polyangiitis, previously called Church-Strauss granulomatosis. If you have granulomatosis with polyangiitis or microscopic polyangiitis, your doctor will likely prescribe medications that suppress the immune system to reduce the inflammatory damage that may occur to your tissues and organs. These medications may suppress the immune system enough that you will actually develop an infection or be at increased risk of developing a cancer. In April of 2001, the FDA approved a new treatment for granulomatosis with polyangiitis and microscopic polyangiitis. Since it is a relatively new treatment, the pharmaceutical company is sponsoring a study to help determine even further the benefits and side effects of this new treatment being used for treating patients with ANCA-positive vasculitis. Our three Mayo Clinic campuses in Arizona, Florida, and Rochester are participating in these studies, and you might be a candidate to participate in them if you have granulomatosis with polyangiitis or microscopic polyangiitis. You may review the details of this study on the internet at clinicaltrials.gov by searching ANCA and observational studies, or by typing in the identifier number, which is NCT 016 13599. In this study, you will be treated according to your doctor's best strategy. A 4-year follow-up period of time is planned to record benefits and side effects that occur of this new therapy. Thank you.
Pros and cons. Pros. In recent times, more than 80% of patients who are treated are alive, at least for 8 or to 9 years. With advancing treatment, they have a higher long-term survival rate and have been able to lead a relatively normal life. The cons. Living with granulomatosis with polyangiitis can be very challenging. They cause fatigue, pain, complications of this kind of disease. issue applied in Ecuador. The diagnosis of the disease is based on the presence of clinical manifestations, the determination of anti-neutrophil cytoplasmatic antibodies, and the performance of anatomopathological studies that confirm the diagnostic suspicion. Our test may be indicated to determine the presence of complications of the extent of the disease.
My laboratory is focused on the biology of neutrophils in inflammatory disease. Neutrophils are key players in autoimmune vasculitis, characterized by the presence of autoantibody called ANCA, directed against neutrophil proteins. One particular form of vasculitis our lab is interested in is granulomatosis with polyangiitis, GPA, which is a severe disease involving vascular inflammation, blood cell necrosis, and the formation of granuloma in various organs like lung and kidney. Also, the main target antigen in GPA has been identified as protein S3, a serine protease located within azurophil granule of neutrophils. We do not know exactly how protein S3 contributes to the inflammatory process and the immune dysregulation in this disease. And that is the question we address in the present study. A hallmark of this disease is a failure in the resolution of inflammation, and one crucial step in this process is the phagocytosis of apoptotic neutrophil by macrophages, which allows the return to homeostasis. Phagocytosis of an apoptotic cell, here in red, will reprogram the macrophage towards an anti-inflammatory phenotype, which will create a microenvironment which will favor the immune silencing. We discovered that PR3 was expressed as a membrane of apoptotic neutrophil, and this expression was increased in the neutrophil from GPA patients. In the current study, we show, using in vitro and in vivo animal models, as well as human sample, that PR3 acts as a danger signal for macrophage, thus completely disrupting the immune silencing, favoring autoimmunity.
The key finding in our study is when a macrophage encounters an apoptotic cell, it triggers a pro-inflammatory response with secretion of various cytokines and chemokines, as well as the induction of nitrite oxides and TILs. Importantly, the mutant of PR3, which cannot be expressed at the membrane, fails to trigger this pro-inflammatory response. By performing the same experiments using various knockout animals, we discovered that the MID-MTA and IL-1 receptor pathway was crucial for this pro-inflammatory effect of PR3.
Conclusion. The importance of this case lies in the typical presentation of mycobacterial infections in an immunocompetent patient, but resident in an endemic area. These infections must be recognized by primary care physicians, especially in populations such as the Ecuador with high risk. Thank you.